We are here with Scott Tafuri of the Galveston County Emergency Management, Galveston, Texas, of course. And they're no stranger to hurricane season. And unfortunately, they're no stranger to hurricanes during the coronavirus pandemic. They were on the western side of Hurricane Laura earlier this year, and also had Tropical Storm Beta make landfall just to their west. So, Scott, thank you for being here today. We appreciate it.
Oh, thank you for having me.
You're very welcome. Now, Scott, I will say before we actually get into the interview, you are a Jersey guy. So this is actually the perfect person to talk to because you know how it is here in Jersey. You're down in Texas. You're working in emergency management. So before we get started, let me just ask, what's the one thing you miss about Jersey?
I miss the food. There's some amazing food out there.
Yes. Yeah, I would definitely agree on that one. So, again, you're the perfect person to talk to because you know what happened here in New Jersey with Sandy. We had Irene, both of which, we had evacuations for. And now during the coronavirus pandemic, the question, many of us are asking in southeastern New Jersey is, well, what would we do if we had to evacuate the shore? So let me start off with this. In the state of Texas, who is issuing the evacuation orders? What level of government's doing that?
So the evacuation order comes from the mayor or the county judge.
Got it. Okay. So in the case of Galveston County, who is issuing that evacuation order? And just give me an idea, how many people were under mandatory or voluntary evacuations for Laura and then again for Beta?
So for Hurricane Laura, pretty much the entire county was either under a mandatory or voluntary evacuation. So approximately 330,000 people. Especially the coastal communities, they were mainly under the mandatory. And that really, try to encourage people to leave, and take those mandatory evacuations seriously. Because some of the surge modeling that we're getting from the National Weather Service, we may not have been able to come and help rescue people at a certain point.
Got it. And then during Beta, I believe there were some voluntary evacuations. Is that true?
Yeah, so we had some voluntary evacuation orders. Same thing, the surge modeling for it was about 4 to 6 feet, which would have impacted some of our roads. Some of our communities that live on the bay side, they had some pretty significant flooding, and you couldn't go anywhere. So if you have any medical needs, or you can't provide, for a couple of days and kind of be that inconvenience, really encourage you to go, stay with a friend or at a hotel.
Sure. And we were saying, earlier that the Galveston County is a non-sheltering county, meaning that, really if you need to evacuate, you're evacuating outside of the county. So where would people typically evacuate to, if they weren't going to a friend's or family's house?
So we have a point-to-point agreement with the city of Austin. So we notify them and we bring in a lot of buses. So this year we're taking COVID under consideration. Opposed to putting, 40, 50 people on the bus, we brought in a lot of extra buses, and we were putting about 15 to 20 people on a bus, screening them beforehand, making sure that they had the proper PPE for their travels to Austin. And then once they got to Austin, they were put up in hotels. We talked about congregate sheltering that we've seen in the past. We really couldn't do this year. So having that option to put people in hotels really helped us out to kind of make sure that we segregate people so we weren't, helping the spread of the coronavirus.
Right. And when you're talking about the busing, right, so you were screening people ahead of time, but what if someone did either test positive or were running a fever? What would you do in that case?
So we had ambulance strike teams too that were here that we were able to bring in with the help of the state. And then there are medical shelters that we would bring them to with the help of the state.
Got it. Okay. So all in all, about how many people did you actually have to transport by bus or by medical transport to Austin for, let's talk about Laura since that was the more impactful one.
So probably, 500 to 1,000 people by bus. And although, other people have their own means of transportation and
right.
They drove themselves and their family to evacuation points.
Got it. And these hotel rooms, I'm assuming, is it family that were going in this? How many people were you having in a hotel room? Was there even were there any considerations for coronavirus and social distancing with that?
Yeah, so I mean, if you're with your family, right? So we'd keep people with their families, so it wouldn't just be in a hotel room with anybody. But we would have the families in a hotel room. The city of Austin, was very proactive, very forward leaning, and already had some pre-identified areas for if people did have need to be isolated if they were waiting on test results, or if they were positive, or if they just came from a family or friends, that are positive. We'd be able to kind of isolate them.
Got it. In New Jersey, I believe most, if not all, people who are taking people into a shelter, who are at the front door as people are coming in, are volunteers. Is that the same in Texas? And if so, what considerations did you have to do with that? Because there's been some talk from for example, Vince Jones, who's our Atlantic County manager, saying that the Department of Health would almost need to take over for people going into an evacuation shelter. Obviously, again, you're not having those evacuation shelters there, but you still were screening people before they were going on buses. So again, just to reiterate the question, is it volunteers who are doing that? And if so, was it medical staff that were doing it in its place this year?
So it's kind of, everybody coming together and helping each other out. So we have volunteers, our local health authority, working together. So if we had to stand up a shelter, we have a lot of great volunteer groups. We have a very active CERT team, community emergency response team here in the county. We have Texas Search and Rescue. We have a great relationship with them that help us out quite frequently. And then also just, county staff wise, between the various departments and the sheriff's office, we have pretty robust capabilities to, help screen people. But we always have that concern of if you are asymptomatic.
Got it.
So really trying to do the social distancing, going from set of 40 square feet per person in a shelter. If we had to set something like that up, going to 110 square feet per person, making sure there's plenty of PPE. Once we, really monitoring the coronavirus as it was evolving, stockpiling PPE in case we had to do an evacuation, in case we had to do a shelter, make sure we have plenty of, Lysol wipes, hand sanitizer, so we could try to be as best prepared as we can.
Sure. And I should ask, during these evacuations, that whether they were mandatory or voluntary, did you have to run into a situation where people were showing symptoms or, did test positive, however you were screening them during this time?
No, luckily we did not. Our numbers have been going down steadily here, which has really helped us out. But, it's something that, luckily we didn't have to experience. And even now that we're a couple weeks afterwards, we're talking with our local health authority. We haven't seen any rise in numbers or anything like that because of the evacuation orders. So, our numbers are still going down. So, that was, definitely one thing is kind of that, secondary effect because, if you, do become affected or infected by coronavirus, it's that incubation period waiting to see what happens. So you don't know those results right away. But right now where we just had our conversation yesterday, looks like everything worked out well for us.
Got it. And just zooming out more into evacuations as a whole, according to National Weather Service, Galveston County, your county, has a return period of a hurricane every 11 years with 25 years for a major Category 3 hurricane. So, assuming you're living in Galveston County your whole life, you're living through more than likely multiple hurricanes and even possibly multiple major hurricanes. So how familiar are people with the evacuation process in the county? And, just going a little bit step further, what's the general, I'll say, attitude towards evacuations in the county when they're issued?
So evacuations are always a hard topic, because you're asking people to leave their homes, what they're comfortable with, and going somewhere that they're not going to have all the comforts of home. So we do some pretty heavy messaging every year before hurricane season. We have a lot of town hall meetings. We didn't have those this year, but we did a lot on social media, a lot to our website, really overhauled our website. We developed the first ever Galveston County specific hurricane and disaster guide. We also developed the kids guide. And kind of really talk about that year after year on, make a plan, build your kit, and stay informed. And those are kind of the three key things that we really try to push before every incident. Even as we were talking and doing our press briefings for Hurricane Laura and Tropical Storm Beta, is really, you should have had your kit, you should have your plan. I mean, this is your go time. Everything you practice is now.
Right. And, given that you were born and, spent a good amount of time in New Jersey, as well as, living through these two events, what advice can you give us here in New Jersey, if we were to get into this kind of situation this year? We're going to say hopefully not, but let's just say we do.
So really the biggest thing is kind of what we just talked about is, make your plan, build your kit, stay informed, listen to local trusted news sources and your elected officials. They're going to give you the most up-to-date current information that they have, with the best information that they have. So staying informed and being prepared to, if you do have to evacuate, that it's not a last minute, oh, I need X, Y, and Z. It's, I already have everything. I'm ready for this. And you go.
Great. Scott, thanks so much for the time. We appreciate it.
Thank you so much. Appreciate it.